we still have a lot of employees out, 33 positive, 46 are self-quarantined. We do need some nurses, so I did want to say that, you know, we're actually looking to add some more staff. We have had some staff that have left to go to other jobs, you know, just quit. It is stressful on our staff, as y'all know, that. So the next thing I want to talk quickly about is the vaccine. Alabama Department of Public Health, thanks to Judy and her team, is now going to allow us to start vaccinating the 75 and older, and I think Judy will probably talk about that. We're working on that at the hospital. So when Judy talks about that, maybe I can come back and give you a little update on what we're doing at Decatur Morgan to help with that then. But those are our numbers as of now.
Thanks, Kelly. Judy?
Well, as Kelly said, the Department of Public Health has released the second priority, well, in conjunction with the governor and medical advisors in Montgomery, has now released the group 75 and above to get the vaccine. Listen, I want to start and end with, if you want a vaccine, we are going to get you a vaccine. If you want one, we're going to get you one. We're going to stay at it as long and as hard as we can to see that you get a vaccine if you want one. You don't all have to show up on the first day, I promise. And the other thing that I would say is, when you hear us say that we're out of vaccine, it doesn't mean we're literally out of vaccine. It may mean that we've got a courier coming to bring some more. It may mean that we may not have any until the next day. So I want to emphasize to everybody, if you do not get it on Monday the 18th, you may not get it that day. You may not get it on Tuesday, but I promise you, we are going to stay at this until we get everybody who wants a vaccine. Now, let me also say that according to the demographics of Morgan County, there are roughly 8,900 seniors, 75 and above. So I promise you, we cannot vaccinate all of you the first day. And I do promise you that we're going to do everything we can to get you the vaccine. I will tell you, I want to tell you a little bit about our process, since obviously we're going to, at least right now, be the primary game in town. I'll tell you what I don't want. The health department is on Highway 31. We don't want anybody to get killed in traffic issue trying to get a vaccine. We don't want to do like some other counties did. We don't want to have people waiting in line for 3 hours and then finding out that we don't have a vaccine dose. So we're going to do the best we can to make it as organized as we can. But again, I say to you, if you don't get it on Monday or Tuesday, we're going to get you that vaccine if you want it. You've hung on this long. Please just be patient with us, and let's hang on a little bit longer. Now, what our plan is as most of you know, the state set up a call center to do appointments, and that's, in a way, is kind of a blessing for us, because we were having to shift staff just to do the appointments. If you couldn't get through the call center, don't worry. Again, we're going to get you a vaccine. It may not be Monday or Tuesday, but we're going to get it. So what we're going to do then Monday, everybody who has an appointment, and we are going to, in as much as possible, try to honor the appointment system, and it will continue to go on. When you come into the health department, first of all, the local police, as well as Hartsville Police and the other folks that they've coordinated with, are going to help us do traffic control, because we simply don't want you to get killed. We don't want you to get hurt trying to rush up there and get that vaccine that I've already promised you I'm going to save for you. But what we're going to do is we're going to let cars in about 20 at a time based on the appointment system. If you have an appointment, you will be given a card that has a big A on it, and I had one somewhere, but I don't know what I've done with it. And they'll ask you, what time was your appointment? At which they will send you on in through 2 different doors that we're going to have a vaccine team there. I can't believe I can't find my big A. But at any rate, and they're going to send you on in. They're going to ask you if you have your paperwork done. And if you do, that's great. You'll take your card with that I had an appointment, and you'll go on in. And if you don't, they're going to ask you just to sit in the car until you get the paperwork done. They will give it to you as you come in the entrance if you don't have it. And then as soon as you get the paperwork filled out, you'll go on into the health department. We'll, if you'll excuse the term, we'll shoot you, not like the police would, but we'll shoot you. You'll need to stay there for at least 15 minutes to be observed, and then we're gonna let you go home. Then as those cars leave, we're gonna let another 10 come in, another 20 come in, based on what the parking lot can accommodate, and we will continue that on throughout the entire day. We intend to do every single day, probably for at least a 2-week period of time. Again, in as much as possible, we are going to honor the appointment system. I will add though, we will not waste a dose of vaccine. It is too valuable, too important to people, and we're not going to waste those doses. So would we squeeze in somebody that didn't have an appointment if they qualify in the 75 and above group? Yes, we would. Yes, we will. So now, once again, we're not going to be able to squeeze in 700 people on Monday, but we will. I will tell you that we have pulled in every nurse that we possibly can from our system for the next 2 weeks, and that includes the TB nurses, the immunization nurses, the HIV nurses, the all thing nurses, to be able to accommodate this and to see that everybody who wants a vaccine gets to have a vaccine. The other thing that we are going to do, this is the packet that folks will need. The first part of the packet, to be very honest, is really information that we're required by CDC to give you about the vaccine. Now, if you already know more than you've ever wanted to know about the vaccine, then make airplanes out of it or take notes on the back of it later, but we're required to give it to you. Then behind there is a consent form that you will have to fill out. Now, when you get there that day, that is the most important form. We will not give you the vaccine until you've signed a consent form. There is another sheet of paper that we're going to go over with you that we don't want you to fill out until that morning, and it basically says, are you sick? Do you have any symptoms that you're sick? Have you been around anybody that you know of that you're sick? And the worst thing that would happen is we would just defer your vaccine for a week or 2 weeks. Again, we will get you the vaccine. We are going to place some of these. We've left some at the courthouse today, at City Hall today. We're going to have them at the courthouse. They're at the front door of the health department. And they're actually, the EMA actually has them available online. So if you can do this and you have it filled out, it's just going to make life a lot easier for you. If you can't do it, then we're going to help you with it when you get up there. It is kind of a 4-stop shop. You come in, you get your temperature taken, you get registered, you go and you get shot, then you wait for 15 minutes, and then we wave goodbye to you as you head out the door. And the one other thing that you will get while you're there is you will get an immunization card that says on the front that you got Moderna vaccine. As you all know, there are 2 vaccines available. Fortunately, both Kelly and the hospital and we are giving the Moderna vaccine, so it is interchangeable. Now, in addition to getting that card that says what you've gotten, on the back of it, ours will say Morgan County Health Department, and then it will give you the date 4 weeks from now that you are to return. We're not going to chase you down. We're not going to, harass you. We're not going to do anything. You do need to have 2 doses. Your appointment time 4 weeks from now will be same time, same place, just 4 weeks later. So you will have this card. Please put it on your refrigerator and remember to bring it back so that we'll know when you come in with that card, you had Moderna vaccine on this date, and we're prepared to give you your 2nd dose on this date. Let's see, I mentioned the forms. I want to be sure that that I have said everything. Kelly, what are you guys, the hospital will also be giving vaccine. Payless Pharmacy that's close to the hospital also has some of the Moderna vaccine. We're hoping soon, and it couldn't be soon enough for you all or us either, we're hoping that a number of other pharmacies and a number of other healthcare entities will also have the vaccine, including some private doctor's offices. Our hope is that as soon as we do this, we can publicize this, and you'll have options of where you can go to get the vaccine. I will also say, and Kelly, I am going to let you tell something in a minute. I just got, when you get old like me, you got to say it when you think it, or it goes somewhere. You know, if you get your first dose from us, as long as it's Moderna vaccine and you've got your date correct, you can get your second dose with somebody else who has the Moderna vaccine. Now, we're committed to getting the vaccine and providing it to you for that second dose. But if for some reason you get your first dose at the hospital and they're inundated, then the second dose, you can come back to the health department. You just will need to make an appointment. For those of you who get your first dose at the health department, you won't need to make a second appointment. We've already got 4 weeks from now blocked off so that whoever got the first dose will be able to get the second dose. So Kelly, what are you guys doing about as far as being able?
We actually created a form online, so you can go to DecaturMorganHospital.net and fill out a form, and it actually goes ahead and puts you on a waiting list that we will call and to schedule an appointment for you to come to the vaccine clinic, just like Judy. We want everybody to have an appointment, not only so we can track it, but also we can social distance and make sure that we observe you for the 15 minutes, that you don't have any kind of reactions to it. So go online, fill out that form. We've already had 600 people here in Morgan County fill out the form online
That's
over the weekend.
wonderful.
So again, we're trying to figure out how many clinics we can have to get these people vaccinated as soon as possible.
And I want to thank Decatur Morgan for the partnership that we have had, I feel, with the health departments. You know, the one thing that, and I'll be honest, the community to some extent is responsible for this. Kelly and her team, as she already told you earlier, are tied up taking care of patients. You know, we would have loved it if we had had both of us could have opened up the door and seen 1,000 folks a week each. Mm-hmm. You know, we would have had this totally whipped out in at least 4 weeks. We still are hoping for good things as we get our other partners on board. But right now, her team is so drastically tied up with taking care of folks that are sick with COVID and other things, but particularly the impact that COVID has had on the situation. And you heard Kelly ask for other nurses. I would like to mention to her she cannot have any of mine. It would be the kiss of death, and I will not talk nice about her the next time we come on if she steals any of mine. Now, I'm perfectly willing to steal some of hers. So the other thing I am going to ask you to do, and I am going to ask a huge favor of the entire public, when you come up there, or you go to the hospital, or you go to Payless Pharmacy, wherever you go, when you go through the line, when you get there, tell our staff thank you. That's all they want. They just want to know, they just want thank you. Now, if you want to fuss, you know, first of all, I will say it's okay. It's okay. You know, we're probably not going to get it perfect. We're going to make mistakes. There are things that we'll change as we go along. But fuss at me, I'd rather you'd wait a week or so to fuss at me so I can spend my time trying to get clinics going for you and trying to see what we can do. Hey, I've got a better idea. Send your complaints to Mayor Bowling at the City Hall, and then he can decide. I'm teasing. You know, it is fine. Now, let me say this. If the nurses don't chat with you, part of the reason is I have asked them, let's get these folks vaccinated and let's move on. If they do chat with you, cut them off and tell them they need to get busy, because that's what I've already told them to do, and just tell them to move on. So the bottom line to this, and I want to say again, if you want a vaccine, we're going to get you a vaccine. I want to add one other thing, well, actually a couple of other things. First of all, you know, we've already talked about the impact in the hospital and where we are now with COVID in Morgan County. I want to tell you another little tragedy. 25%, well, it actually is 25%, but 25 of the deaths since December the 31st have occurred here in Morgan County. So of the 104, 25 of those deaths have occurred since December the 31st. So in the 11 days of this month, we've already lost 25 of our citizens. Again, that speaks to how tragic this situation is and how imperative that it is that we continue to do the things that we need to do. The one other thing that I want to add is I got my insurance bill for my car recently, and it's never a lot of fun. I don't really enjoy getting it, and I hope I never have to use it. But it's wonderful to have, because, and I have had to use it a time or two, but Fortunately for nothing tragic, but it is wonderful to have there. But it is just a level of protection. It's a safety net for me to be there in case something goes wrong and something happens. This vaccination you're going to get is exactly the same thing. Once you get it, it does not turn you into Superman with that first dose. It's probably not going to turn you into Superman with the second dose. But with the first dose, you still got to do the things that you've got to do. It's only going to build up partial immunity. It takes 7 to 14 days to do that. And then we still got to wait on that second dose. But it does not turn you into Superman. You've got to continue to do the mask. You've got to continue to do the distancing. We cannot afford to have all of our staff. We cannot afford to lose 25 more people in the next 11 days. We've got to take care of our citizens. We will get there if we all try to get there together. And I would say hold hands and go out in the world together, but you can't hold hands right now unless you've got gloves on. But please, and I want to end with how I started. If you want a vaccine, we're going to get you a vaccine. Just hang on and cooperate with us and do the best you can. And we'll get there together. Thank you so much, and thank you for allowing me to talk today. By the way, this is the 1-800, it's not 1-800, I don't think, is it 800? 1-855 number that is for the appointment system, the state appointment system for the health department. Thank you again.
I want to add one thing. Don't register both, because if you register and have an appointment at the health department and you have an appointment with us, then somebody will miss out on getting a vaccine because we will think that you're coming. So please either register at the health department or with the hospital so that we can give out as many as possible. And thank you, Judy. I appreciate working with you. You've been great, you and your staff to work with. Thank you.
Well, thank both of you. I mean, the logistics and the planning and the leadership you guys have shown, how to, this stuff came on pretty quick, and setting things up to help us get people vaccinated as fast and efficiently as we can. That's great work by you and your team. So thank you for that. Again, thank you, like I said last week, our appreciation for our healthcare workers. I think we always had that. Growing up as a kid, we appreciate our doctors and nurses, but this year has brought on a whole new level of that. So like Judy said, thank our healthcare workers when you see them out in public. We're grateful for their service. The next press conference will be Tuesday, January 19th at 11 a.m. The City of Decatur's admin offices will be closed on Monday next week in observance of Martin Luther King Jr. Day. And with that, we'll take some questions.
Yeah, so I had previously spoken to an infectious disease specialist from Huntsville Hospital a couple weeks back. I think they said it was about 80% of the population or 70%, I forget the actual number, have to be vaccinated in order for things to possibly be any different. Mm-hmm. With that being said, are you guys happy with the amount of people who have been vaccinated or the people who have had that option? Do you think that there's a sufficient amount of people who have gotten it?
Not yet. I think we're getting there. But no,
I'll never be happy until the 70% is done.
Yes.
And I will just say, we don't want anybody to die. We also don't want to kill off our nurses. And a lot of people have left the profession, just as Kelly said, because they thought, hey, when I did this, I didn't sign, this is not what I signed up for. Mm-hmm. And then there's us old folks that are just keep on hanging in there. So until we get to the 70%, but we can do that even with, some of the infections we've got. If people will just hang on till May or June between vaccinations and between doing the stuff that's right, the masking, the distances, we can get where we need to go. And I get to have a vacation this summer.
Well, I hope that you get to do that.
Thank you, I do too.
With that being said, what do you say to the people, because I know there's a lot in Alabama who are skeptical about this vaccine?
It's been funny, and I don't what like Kelly said, they've already had 600 people to sign up. As you all know, there were 1.1 million people that called into the call center. I think that came out on the news, so clearly there are a lot of people. Another interesting thing that has kind of happened is, while it was kind of restricted to first responders and some of the other folks, everybody was afraid. Now that we're opening up the door to get the vaccine, even the folks that didn't want it before suddenly are afraid their dose is going to be gone. And I think you're gonna see as time goes on, I think you're gonna see more and more people feel comfortable with it. Because I do some of the shooting, and I know that I'm not the one you're gonna request down there, and I also did some of the testing. I have had mine and had no trouble whatsoever. You know, I intend to, even if you don't enjoy me on the press conferences, I intend to keep at it. We're gonna keep at this, whatever it takes to get past this and get all of our citizens, all of our residents back to where we need to be.
Last thing about the vaccines, have you guys seen any bad reactions, or I guess just any reactions, and if so, what is the severity of those? And has it been with people who had some sort of pre-existing?
I'm only aware of two, and one of them, and Kelly has talked about that in previous, and I'll let her talk about that too. There also was another one that I am aware of, not here, but in another county health department. To my knowledge, both of those individuals, and I know that yours did, had a history of having a previous severe anaphylactic reaction. Now, I will tell you that if we know that at the county health department, we're not gonna do it there. People who really feel like they need that vaccine, first of all, need to have it approved through their physicians. We would rather their physician give it, but at a minimum, we want them where they can get the emergency care that they need. We want them to be on site at a place where you don't have to transport them and you don't get in trouble. Kelly, respond more if you feel
Yeah.
that they...
The same as Judy. We had one reaction, and that person, as I've said before, they knew that they had an anaphylactic reaction before, but they also had health conditions, and she knew she was going to, and she's fine now. So we've had some other minor, but most of them are not related to the vaccine. Usually, some people are anxious. I mean, people are scared of needles. There's people who are scared of blood. So even my healthcare workers, there's some people that don't like getting shots. So you get a little anxious sometimes. But no, I mean, I've taken the Pfizer, both the initial and the second dose, and I had nothing. So I feel it's very safe.
Good. Well, that's good to hear. Last thing, I know as of last week, Morgan County had the fifth highest positivity rate in the whole state. Do we know where that stands now? Is it the same, or?
I've not looked at the numbers today.
It's actually down. Actually, the positivity rate for the last 14 days is down. It's actually down to about 30%. And I don't have the numbers in terms of where that falls in, in the state counties. But having said that, a lot of that is relevant to getting the test done. A lot of that is relevant to, our concern is we're now 2 weeks past Christmas. We're still working on the New Year's piece of it. We're 11 days past New Year's. And so our concern is that it's gonna go back up the end of this week. But what we know from the timeline of this disease is the end of this week and next week could potentially be a much larger impact for the hospital in terms of hospitalizations. And we just absolutely, I need Kelly's team helping me vaccinate. And I need people in this community, as does Kelly and everybody else, to not be sick in the hospital, to not be on a ventilator, and for goodness sakes, to not die and not be able to go home to their families. So, we can't undo what we've done, 2 weeks ago, but we can sure as squat take on from now and go forward from here. So
Yeah, the positivity rate's down, but to Kelly's point, you were down to 66 in the hospital, and now we're back up into the 80s. So there's probably some lag there.
Right.
Yeah. It takes a little while for the patients to get sick enough, as Judy's mentioned before.
you get sick, you're a little bit sick, then you get to feeling worse, then within a week or so, you're really sick. And so, if you look at the trend, the timeline on the disease itself, it's usually a week after exposure, roughly, when you get symptoms. And then the next week you get worse symptoms, and then the next week you're at the hospital. So the positivity rate on test is not necessarily a true indicator of what's actually going on. Now, it may be helpful in terms of future projections, but, to ride on that, you're not gonna ride into the sunset because it'll get you in trouble. So,
Well, thank you.
you're very welcome. Thank you all for helping us.
Hey, Lauren, are you with us?
Yeah, I'm here.
Okay, please proceed with your question.
perfect. Hey guys, good morning. It's Lauren Parkson with WHNT News 19. I'm wondering if we know how many or about how many vaccines will be available on the 18th for the public.
Well, I will say from the health department standpoint, we're gonna schedule, our appointment system is 100 to 150 that we are going to try to do each day, a minimum, which we hope is gonna yield by the end of that week, of course, 750 that we hope minimum that we will do in a week. Again, if we can pull in additional vaccine, if we can pull in additional teams, we'll do more than that, but that is our goal right now, and that's the way the appointment system has been set up. I think Kelly and them, they're gonna have to look at their, I'll let you answer that, Kelly.
Ours is about the same. We're 150 to 200 that we can put in our appointment system. We're looking right now, should we do it 12 hours like we did our employees, or should we do half days due to staffing? So, you know, if I could get some more nurses to help give vaccines, I could probably open it up more and do more.
Okay, perfect. And then if people already had the virus, already had COVID-19, should they too get the vaccine when it's available?
Well, the short answer to that is yes, but the longer answer to it, or the better answer, is that we encourage them to delay for about 90 days. You know, we probably wouldn't fight with you after 60 days, but we know that if you've actually had COVID, you're gonna have some immunity. So give it 60 days, let things calm down, and we're still gonna have a vaccine for you. So you really ought to put it off for about, it's not contraindicated, but the recommendation is to put it off for about 90 days from the time you have the disease.
Okay, perfect, thank you. And then I was wondering if we could get an update on how many vaccines have been distributed throughout Morgan County so far. Obviously, it's not open to the public yet, but just an update on the numbers.
Well, I hate to tell you, if I'd have been real smart, I'd have brought that number with me. I will say that they probably have done about 500 a week. I can get that accurate number, but honestly, I failed to bring it with me. We're keeping up day by day at the health department how many doses are given. And I do have it. I'm sorry, I don't have the.
We have it too, but I didn't bring it with me. So if you'll email us, we can get you the numbers.
Okay, perfect, thank you. And then we got plenty of viewer calls and emails, as y'all know, of a lot of people not being able to get through to the public health department. And a lot of people were asking if the phone number is the only way of making an appointment with y'all, or if there's an email or something.
The appointment is to be made through the state call center for health departments, and they're making them for all counties in Alabama. Now, because of the hit Friday with 1.1 million calls, you're right, people could not get through. I would like to hope that it has toned down. I will tell you that if you call the health department, we're no longer making the appointments there. And once again, what we're trying to do is divert the staff that we have to actually doing the vaccination program. So don't call the health department, don't call the hospital. And I think that press release actually went out. Use the email for the hospital, use the call number, the 855 number that's posted on the press release, and I have sitting here to make your appointment. And just be patient and stay at it. If you can't get in that first time, then we're still going to have that vaccine for you. If you want the vaccine, we're going to see that you have the vaccine.
And ours is, you go to our website at DecaturMorganHospital.net, and there's a form. It's an interactive form. So you just put your name, your telephone number, your date of birth, and an email address, and it puts you in the waiting list, and we will call you to schedule your appointment.
Perfect, thank y'all. And my last question is about, of course, the nurses that are needed at the hospital right now. Do we know how many are working versus how many are normally working?
Sorry, I didn't hear the first part of that.
How many nurses are currently working as opposed to normal staffing?
We're about 60 nurses down. We have 60 or 65 open RN positions. They're not all full-time, but it's still a lot of RNs.
I've had the virus, so
By the way, I wasn't going to be too ugly to him, but we have one dose left that we were going to give to somebody, and he doesn't need it for 90 days. So I will have that dose for somebody.
So we're working with the state in trying to determine if the governor's order allows for retired physicians and nurses to come back under temporary license to be able to perform their duties. Many are looking to do that, and we're hoping that we'll be able to get timely answers on that.
Okay, good.
In addition to that, let me also say, we have an order from the state health officer that allows licensed EMTs and actually nursing students, pharmacy students, pharmacists to also administer the vaccine, which is absolutely wonderful. And I think the mayor hit on, there's a lot of critical pieces, but there's two really critical pieces to this. And the first one is the availability of the vaccine. And then the second one is the availability of staff. So we can line up all the people we want, but we're dependent on the federal government and the distribution, the availability and the distribution to get that vaccine. And then once it's here, it's again having the availability of staff to give that vaccine. And when I was saying a while ago, please at least say thank you to the folks at the vaccination sites when you go. Listen, they have no control over the amount of vaccine that we get. They have no control over the process of the distribution from the federal government or the call center. So once again, send your complaints to Mayor Bowling. I'm kidding. Send the hospitals to the hospitals and mine to me. But just keep in mind, they're kind of like, it's always grieved me when people fussed at the waitress because their steak was overdone. The waitress has nothing to do with it. It's the chef and the owner that you need to fuss at. Well, these nurses their job is to get these vaccines to you so you can be protected. Again, we certainly want to listen to what your concerns are, but we're both committed to do everything we can to get this city and this county protected.
You have any other questions, Lauren?
No, that's it. Thank you.
Thank you so
I
much.
have one more thing that I want to ask. Can either of you talk a little bit about the importance of donating blood if you tested positive previously?
Yes, and actually Mayor Bowling was a recipient, if it's okay for us to say that you received the antibody infusion.
Yes.
So
I'm ready to donate blood.
you're ready to donate blood. I'm not sure when, I don't know how long after you can donate, but yes, we do need people who have had COVID-19 to donate blood so that we can get more infusion, monoclonal antibody infusions to give at the hospital. So it's a great thing. So yes, thank you for bringing that up.
But let me add to that, however, if you have had the disease, then please consider doing this for exactly the reasons that Kelly said. However, right now, the blood facilities are trying to evaluate with the CDC what you do after you take the vaccine. And I will tell you that right now, some of them are not accepting blood or plasma immediately after you've had the vaccine. So I'm not sure, we'll need to come back to that question when some determination is made, but because there is a little stall. So go ahead and give your last thing of plasma and then come on and get your vaccine.
Yeah.
Any other questions? Well, thank Judy and Kelly. Thank you both.
Thank you.
Just an outstanding job informing the public about the process to get the vaccine. So thank y'all, and we're finished. Thank you.
Thank you.